Walter Freeman was an American physician and advocate of psychosurgery. Because he had no surgical training, he initially worked with other surgeons. Along with Dr. James W. Watts, he became the first in the U.S. to perform a prefrontal lobotomy by craniotomy in the operating room. Initially, Freeman used an actual ice pick from his own kitchen. Eventually, he upgraded to use an orbitoclast. After previous methods left one of his instruments lodged into a patient's skull. These instruments were inserted into the back of the eye orbits and then hammered into the skull. They were wiggled back and forth in order to sever connections to the prefrontal cortex in the frontal lobes of the brain. This procedure often left patients in a vegetative state or reduced their behavior to childlike. Freeman took his newly modified procedure on a national campaign in his van, which he dubbed his Lobotomobile. He would demonstrate the surgery to doctors working at state-run institutions. His most notorious surgery was performed on Rosemary Kennedy, who was left in a vegetative state at the age of 23. Following the procedure, she became severely disabled, was unable to function independently, and was institutionalized for the remainder of her life. In 1967, Freeman received a visit from Helen Mortensen, a woman who had been one of his first patients. She had suffered a relapse of her psychiatric symptoms in the past and received a second lobotomy. Now, years later, she was back for a third. Freeman did the surgery and severed a blood vessel in Mortensen's brain. 3 days later, she died. The hospital then revoked Freeman's surgical privileges. Freeman died of cancer in 1972 at the age of 76. He was never sued for lobotomy malpractice, although a suit was in preparation when he died. It is estimated that 490 people died as a result of his practice. Like and follow for more infamous medical stories.